Worrying about your child falling never stops, but there are things you can do to help prevent them from getting hurt. Here to help is Dr. Allison Simpson from Florida Hospital, Tampa. Good morning, Allison. How are you?
I'm great. How are you?
Well, I'm good, but I mean, I have a 3-month-old, so I'm not worried about falls yet, but I can only imagine how much I'm going to worry because I'm learning how common falls really are. And you see them all the time.
We do. We see lots of falls in the ER. Kids falling off their bicycles, kids falling off their skateboards, jumping on trampolines and falling off the trampoline.
Oh, I'm so worried about her falling off the changing table at this point.
Right.
But I mean, with these falls and the way that they can happen and how a lot of times that happens a lot, when do you have the red flag? When do you know it's time to seek help?
Well, if it's difficult with a baby, a 3-month-old baby, because they can't talk to you and they can't tell you their head hurts. But if they're really, really irritable, or they become really lethargic or quiet, they stop feeding, they start vomiting, things like that. Their pupils are unequal.
Oh, what about older kids? What about adolescents? When is it time to seek help if they've fallen off a skateboard, if you will? Yeah,
they'll have a serious headache. They'll have an abnormal gait. They'll tell you they just don't feel right. What else? They start vomiting and they have a serious headache.
I'll say with the
neck
whole
pain.
You know, I think people know the vomiting is an issue, but headache, is it depend on the severity? I mean, a lot of parents, I'm assuming, would just be like, well, take Tylenol. Do you just give them Tylenol, or if it's, you know, when do you know the pain is severe enough to go to the ER?
Well, I think it depends on the head injury itself.
Okay.
Because when kids show up at the ER, what we first do is we assess what type of head injury they've had, what the mechanism of the head injury was, and then we look at each individual patient's clinical assessment. And if you're worried, you should bring your child to the ER and let us check them out.
What can we expect when we get to the ER? You're talking about some of the tests that you do. What's common as far as getting diagnosed with how possible a head injury how severe it could be? Well,
you know, most parents think they're going to receive a CT scan when they show up in the ER, but we believe that CT scans are very dangerous to children, unlike in an adult population. The risk decreases with age. So we have some guidelines that we use called the PCARN guidelines, and it actually tells us which patients need to have a CT and which patients don't.
Can I ask more about that? Because I mean, other than having a fancy name, what does it really mean?
Well, for example, if the child has had a head injury of a 300-pound soccer goal, that's a pretty severe head injury. If he's in a major car accident, was not restrained, that's a pretty severe head injury. So we have these guidelines that we use for children under the age of 2 and children over the age of 2. And if they meet these guidelines, then we don't need to do a CT.
Well, I think one of the keys too, of course, Dr. Simpson, is prevention. What can parents do to prevent these falls? Not that we don't want to see an ER, but let's keep these ER visits to a minimum.
Well, prevention is very important, and I think a helmet when you're riding a bicycle or a skateboard is very, very important. Booster seats and car seats for children, according to their age and weight, those are very important aspects when you're riding in a car. Having the child in the back seat as opposed to the front seat so that they are not hurt with the airbag if the airbag goes off.
Okay, well, I'll say we've got the tips, we've got what happens to the ER and when to go to the ER. Hopefully that is not the case. Doctor, thank you so much for your time today. We appreciate it. And for more information on kid-friendly emergency room areas at Florida Hospital, all you have to do is visit erforchildren.com. Thank you again, Dr. Simpson.
Thank you.